Okay, so welcome back on top the show. More like a continuation, but because I think there was a time he actually talked about the Delta variant. Okay, but this morning we look into that, and of course lots more. They talk about vaccines, they talk about the Delta variant, and every other thing we're not supposed to know on top the shows. Talking about Health Matter. I remember I say this is Shelley every Saturday from 8:30 to 9:30 with myself and Dr. Barth, who they reason everything with the trend for the world of health. All right, and just like I said, I mean, always I've never seen a doctor this spicy. My doctor is always looking elegantly dressed. I don't know, but really he complements entertainment. But that is what we stand for. So,
thank you very
Doctor,
much for your kind words. You're looking sweet as always.
Thank you.
Slimmest of them all.
Yes, my doctor.
I'm happy
Sure,
to be
sir.
back.
Good
Yes,
to have you too.
Yeah, thank you very much. Good morning, viewers at home and around the world. We're happy to be back today, as you can see on our faces. This morning, we'll be looking at yet another very important topic, the Delta variant, and vaccine protection will be the topic for today's presentation. The Delta variant and vaccine protection. I must be honest with you, the focus has shifted back to prevention because of the predominant COVID-19 strain that is fast ravaging the world. As of this month, 142 countries have been affected by this rapidly spreading COVID-19 strain. Permit me to start by saying there are thousands of COVID-19 strains that are circulating in our environment. But there are some of them that WHO and, of course, Center for Disease and Control and Prevention in the US have termed COVID strains of concern, COVID strains of variants of concern. 4 categories belong to these variants of concern. And top on the list is the Delta variant that we'll be looking at today. But let me go back and give an overview of where we are with respect to the global affectation of COVID-19 in the world. At the moment, the case load we have globally is about 227,887, meaning that more than 216 million people have been affected globally by COVID-19 pandemic. And it has caused nearly 5 million deaths. The specific number is 4,499,271 persons have succumbed, unfortunately, to this deadly pandemic. Suffice also to point out that the lucky ones that were able to survive, regardless of having been infected, their number stands as of today at 193,215,580. 580 people have recovered, have been infected and recovered. Let's bring it nearer home. At the moment, as of yesterday, the total affectation in Nigeria stands at 190,333 persons have been affected in our country, Nigeria. And of course, it has caused a total of 2,308 deaths, fatalities. So meaning that 2,308 persons have actually died. These are reported figures. Suffice also to say that it could be more.
Yeah.
Okay, because a good number of people, we know what statistics is in this environment, that may have died, may have gone unreported. And over the last 24 hours, Nigeria has equally recorded 10 fatalities. 10 people have died in Nigeria. And so far, we have carried out over 2.7 million COVID-19 tests in the country No, but this morning, the focus will be on the Delta variant. Prior to this time, the initial classification or nomenclature that we were used to were the ones that had to do with numbers. But all of that have changed. WHO has made it in such a way that it will be very much simplified for easier understanding. The variants of concern, top on the list, of course, is the Delta variant. But I must also point out that it wasn't the one that was discovered. The first one that was discovered, aside the original virus that came from Wuhan, was the Alpha variant. Of course, after the Alpha variant was said to have started in the UK and spread across the globe. Next to Alpha variant was the Beta variant that was first identified in South Africa and spread to a number of countries. And then we have the Gamma variant. The Gamma variant, the P1, was said to have started in Brazil and so far has affected about 10 to 11 countries of the world. The most predominant of them all,
Delta,
that has affected 142 countries as we speak, is the so-called Delta variant. Let me give an overview of how these variants come into being. Viruses, just like it's normal for humans to be born, grow over time, it is also like that for viruses.
Okay.
They replicate over time as they spread, not just for COVID-19, SARS-CoV-2 virus. It is so for all other viruses. But as they replicate, as they enter the human body and make copies, millions of copies of themselves and replicate, along the line, some errors may occur in the course of replication. Those errors that may occur as a result of those replications are what give rise to mutations that eventually will be regarded as variants. Some of these mutations that may occur may not pose any threat to public health. They may be inconsequential. Sometimes they may even harm the virus itself. But a few of them will become much more virulent than its parent, in quotes now. And of course, that is what we see with the Delta variant. Now, to be a little bit scientific, the molecule of the SARS-CoV-2 virus usually has a protein shell. Inside the protein shell, you have the genetic material. Outside of the protein shell, you have what is referred to as spike proteins. These spike proteins are actually what enables it to get attached to the human cells. And that is how they penetrate into the human cells and, of course, start replication. But what has happened that has made the Delta variant a lot more contagious is the fact that the mutations that have occurred on its spike proteins have actually made it capable of not just penetrating the human cells, but being able to evade the body's defense systems. They're able to escape unidentified by the body's defense systems, regardless of the person's immunization status now, whether you're immunized or not. Does that mean that vaccination does not have any relevance again? The answer, of course, is capital no. So vaccination is still very important, and of course, it is a major tool that can actually bring about eradication, if that is going to be possible. We are expecting that over time, this pandemic could peter out over a period of 3 to 4 years. if the rate of vaccination across the globe is increased as expected, why are people who get vaccinated still able to get infected with COVID-19, particularly the Delta variant? Now, that is what a question that the scientific community at the moment are battling to find answers to. People who are fully immunized that gets infected are referred to as breakthrough infection. And of course, it is beginning to rise globally, especially in the US. I have a figure that says that about 35,000 people are found to have breakthrough infections among the 162 million fully vaccinated people on weekly basis in the US. That number is not a small figure. But the truth of the matter is that vaccine still gives us that edge of being able to avoid becoming severely sick, hospitalized, or even dying as a result of COVID-19 infection. That is the edge that full vaccination can actually confer on each and every one of us.
Doctor, does it also apply to the Delta variant?
It applies to Delta variant as well. However, it is not so for people who are not vaccinated. Those set of people at highest risk of becoming severely infected, becoming severely sick, those people are more likely to end up requiring oxygen supplementation in the hospital, and of course, life support and what have you. And COVID-19 is actually killing a lot more among the unvaccinated population. The bulk of the fatalities that are being recorded globally, particularly in the US, are usually found among the population that are unvaccinated. So the vaccination is still very much relevant. Now, I also like to point out that ideally, in ideal situation, vaccine should protect everybody who is fully vaccinated from picking up the infection in the first instance. But that is not so with the vaccines, with the class of vaccines that we have for COVID-19 today. Meaning that they are not 100%, they can't confer 100% protection to any individual who has gotten fully vaccinated. They cannot confer 100% protection. As a matter of fact, people who are vaccinated will have just some of the studies, recent studies that we have seen, has shown that people who are vaccinated will have about 8-fold in the reduction of risk. So they will still carry the virus and, of course, still be able to transmit it to others.
I think I have a question on that already, but time don't reach for us to open our phone lines. Like I've been getting my own question just before we go for the break, okay? And definitely I'm going to ask Dr. Barth. Now, feel free to call those numbers on your screen, 08173147589, and of course 08105434984. Please help us turn down the volume of your TV set as you do tricolor. So first up, Dr. Barth, please, do we have Delta variant in Nigeria? That's my first question. Then number two, I was about to, when you said, you talked about the fact that, okay, once you get the dose, it doesn't it is not like 100% safety and all of that. So if I'm speaking for the Delta variant now. So if I get my doses, can somebody still die of the Delta variant even after getting the COVID-19 vaccine? Or you will just like normal COVID-19, you just, have it and it won't give you too much symptoms and all of that, unlike those persons that are not vaccinated. And then I wrote something here, where is it at? Okay, so what is the essence of the second dose? Because I know that when you get the first one, they still tell you to come back maybe after a couple of months, come get the second dose of the vaccine. So those are my three questions, if you have them.
Thank you very much. Okay, so I'll start with the first one.
Okay, sir.
The simplest of them all.
No problem.
Yeah,
Doctor.
is Delta variant present in Nigeria? The answer is capital yes.
Ooh.
We have Delta variant in Nigeria. Variant of concerns is what they are called. So Delta variant is in Nigeria, and like we said earlier on, 142 countries have so far reported Delta variant within their borders. Okay. Second question: will you still die even after getting your full vaccination or full immunization to COVID? That's what we usually talk about. Doctors talk about in medicine. Never say never. Okay, so that statement is very apt when you're discussing about medical issues or health issues. Yes, there have been documented evidence of people who had breakthrough infections and at the end of the day died afterwards, even after getting fully vaccinated. Okay, and we have documentation to back up that. Now, your third question said, why should there be a reason to have a second dose?
Yes, sir.
Now, if you listen to the second video presentation that we had, the woman also asked that question. That what degree of protection will the first dose confer? First dose of vaccines.
Yes, sir.
Keep in mind that it is not all the vaccine shots that you have to take 2 doses.
Okay.
Some of them are just one.
Okay.
Okay. For instance, Johnson & Johnson has just a single dose. Whereas the messenger RNA vaccines, the one from Pfizer, BioNTech, and Moderna, which of course is equal in Nigeria as we speak, people are getting that. Those ones have 2 doses. Ditto for AstraZeneca that came into Nigeria ahead of them all. Okay. Now, the 2 doses, because I said this keeping in mind that a good number of Nigerians have gotten just 1 dose.
Yes, sir. And
they're struggling to get the second dose, but they've not been able to do so. Some even have the challenge of getting AstraZeneca, and they are trying to see, can we take Moderna? Can it act as a second dose and all of that? I'm sure they will be guided because usually you'll be given a form. You'll be given some documentation to show the one you have gotten. Okay? Now, you need the full 2 doses, 2 shots to have the best of coverage. Let me use that word because I don't want to use the word.
You don't say full immunity.
Yes, full immunity or 100% protection. Okay, and then I also would like to point out that this best of coverage that you should have when you get the 2 shots will still not come into play until after 2 weeks of receiving your second shot. Okay, so whether or not you've been immunized, one thing you must ensure, just like I said in the beginning, that the focus has now shifted back to protection. Not that it was off protection at the beginning or along the line, but more importantly, emphasis now is on protection. And that is why it's advisable for people who are fully vaccinated and the unvaccinated members of people who are unvaccinated in our population, we all still need to have our face mask. We have
Daniel. All right, Daniel, good morning.
Good morning, WAP TV. Good morning, beautiful Slimity.
Good morning,
Mr. Daniel.
Dr. Barth, good morning.
Good morning, my brother. How is Plateau today?
Plateau, this place is hot too.
Sorry, we'll send the rain. Okay, so you have a question for Doctor?
Yes.
All right, please go on.
But my question is not pertinent to what you guys are discussing today. Just that I'm just confused. I want to ask the doctor, please, what is going on in this country? Like, everybody's just falling sick here and there, sickness, everybody, like, all my friends, family related, everybody just falling sick. So is it that there's an outbreak of any disease or the other, or I don't know, but the rate at which people are falling sick since last month and this month is just too much.
Thank you very much. Thank you very much. Your question is very much related to what we are discussing. Very much related to what we are discussing. Why are people falling sick? I've had that question. I've also had to ask because the rest of our attendants in hospitals are on the increase. Okay? Ditto for hospitalized admitted patients in the world or in the world. Now, in Nigeria, we could lay our hands on a number of factors. Number one is that I must point out that there's ongoing active cholera outbreak. And of course, we dealt with cholera a week and two ago. Yes. Okay, so it's still very much active, and of course, it's killing so many. Okay, so we don't need to lose our guard. That said, the other reasons too may be related to the COVID pandemic that we are discussing today, to the Delta variant. Keep in mind that in this part of the world, we have a poor health seeking habit. Poor health seeking habit. In the sense that a good number of people that will fall sick may not even get to the confines of any hospital. They won't visit hospitals. Yes. Some may even not go to any pharmacy around them. Okay, so some may take to herbal medicine and stay at home, and oftentimes they may survive. On some other times, they may not be very fortunate. So that could be a reason. I'm trying to say that some of the sicknesses that we're having in our environment may not be known. So it stands to reason that Delta variant could be the unknown bystander that is causing a lot of havoc. Okay? Okay, but I'm not taking that in isolation. I'm just taking a global look. Yes. Okay, but truly, I've gotten that gist, and I know it is a fact that people are getting sick by the day, and some of the reasons are not yet known. And of course, that brings us to the measures of protection that we have always talked about that we need to imbibe at all times. Okay, because you discover that if you maintain clean sanitary environment around you, wash your hands at all times and everything, it will not only prevent you from picking up infection like COVID-19 that we are discussing today, it will also prevent you from getting infected with cholera.
Okay. Adamu, good morning.
Good morning.
How are you doing today?
I'm fine.
All right, please go on with your question.
Yes. My question is, hello?
Yes,
hello,
go on,
can
proceed,
hear you.
we are with you.
Yes, good morning, doctor.
Good morning, Adamu. How is Taraba?
For Taraba is fine.
Yeah, thank you, sir.
Yes, I'm asking this issue of this COVID data, or what they call it, COVID variant. Taraba is fine.
Thank you. Go ahead, sir.
Yes, this COVID data, COVID variant, because I watch distance. I watched this morning when one of she was communicating with somebody from World Health Organization.
Okay. One of the videos we played.
Yes.
Okay.
Yes, and she was saying that if one takes the vaccine, and that vaccine that is not to protect somebody from not contacting the disease.
Yes.
The extent of taking the vaccine.
Thank you very much. I'll be surprised if that question.
Yes, you will keep getting
if this question didn't come.
I mean,
yes. Okay. Thank you very much. Let me say this in trying to answer Mr. Adamu's question. It's not all the vaccines. Keep aside the COVID vaccines for now. It's not all the vaccines that confer 100% protection. The vaccines that we have had before now, it is not all of them that can confer 100% protection on individuals who have taken them. A good examples of vaccines that can't confer 100% protection on people who have taken them is, number one, typhoid vaccine, malaria vaccine. At least let me use that one. That everybody knows about malaria in this environment. Though not in Nigeria, it's been there's an ongoing trial with malaria vaccine in 3 countries in Africa: Malawi, Kenya, and one other country. Okay, so they don't all confer 100% protection on individuals who have received such vaccines. Okay, not just because of COVID. Now, COVID-19 vaccine is not different from these vaccines that have been out before, but in a number of respects, okay, because now we have genetic vaccines, which we never had, okay, as a result of COVID-19 challenges. Now, what has happened is that the vaccine, the essence of taking the vaccine, number one, in as much as it's not going to protect you from picking up the infection, if you do pick up the infection, you're sure you're not likely to end up with a severe disease that will necessitate hospitalization and death. So it prevents against severe disease, hospitalization, and death. Okay, that is what the vaccine, that is what the vaccine will do for you and I, for those of us who have received them. Now, it is better to go for the vaccine than not to go for the vaccine.
Yes.
This morning, I was watching, in the course of reading, I saw a video in the US where the family members had to communicate with their breadwinner through a screen, okay, with the help of technology. And the man was one of the people who was canvassing against taking vaccine. Eventually, he caught COVID. He's on all sorts of gadgets, supplemental oxygen and all whatnot. He was communicating with the family members, and the wife was interviewed. The wife said, if only he went for the vaccine. The wife actually
he was campaigning against the vaccine.
Yes.
Oh my.
You know, there are a lot of people who are campaigning against people taking vaccines. We hear also, some say he's magnet, he does this, he does that. Those are not true, okay? But the fact still remains that vaccine, for now, is the best tool. Why we're having large number of breakthrough infections are because the vaccine there are still vaccine hesitancy, okay? A lot of people, even places where they are available, are not coming out to take the vaccine. And that is why we are using US as a case study, because they are the producers, major producers of the vaccine. They have it themselves. Not to talk of third world countries like Africa and Nigeria, in which case we have to depend on others to supply to us. But I'm happy with the response I'm seeing in Nigeria. Almost all the places in Lagos
are booked.
Yes, that you booked.
Like over 100.
You will see crowd milling around, struggling to get vaccinated. Some are even trying to give stipends to clear the ways to get vaccinated. I like the fact that we're coming out in Nigeria to get vaccinated. Okay, but unfortunately, we don't have enough that will go around to everybody who desires to have the vaccination. Okay, that is the truth of the matter.
So get vaccinated.
So if there's anything you need to do, if it gets to your turn, please do not hesitate to take the vaccine. It protects you regardless of
for Lagos, you can register.
Regardless of the fact that people may have breakthrough infection. WHO has come out to say that they are less than 1%. So that is very, very insignificant. So that must be pointed out. Okay, so the vaccine will still give you an edge in a number of respects. There are 5 things that we need to know about the Delta variant. I will start with number 1. Delta is more contagious than other virus strains. At the beginning, I said there are thousands of SARS-CoV-2 strains or variants. Charles from Lagos. Good morning, sir.
Good morning.
Please go on with your question, Sir Charles.
Okay, my question goes like this. The issue of the vaccine, I think a lot of people are playing groundnut on it. I also want the doctor to emphasize more, because I was invited for the vaccine, and when I told my cousins about it, they told me not to go. This is that. So I want the doctor to also to enlighten the public about this vaccine, because a lot of us are playing groundnut on it, saying that it has a side effect and all of that. Just trying to discourage me not to take the vaccine.
Thank you very much. Thank you very much for that question. Thank you very much. It's not only in Nigeria that challenges with the problem of vaccine hesitancy can be found not just in Nigeria, in a number of countries, even in the US, that they have all the opportunities. In fact, they are moving from streets to streets, trying to get people to coerce people into taking. And then very recently, the FDA has given an approval. So one of the vaccines now has a final approval. Okay, FDA has given an approval for Pfizer-BioNTech vaccine. So we expect to see people being mandated to take the vaccine. Okay, now coming back to the question that Mr. Charles the emphasis that he wants me to make. Now, the fact still remains that the vaccines that we have in Nigeria at the moment are very, very safe. All the vaccines in Nigeria are the ones that have been listed by WHO. Okay? Those are vaccines that have gotten emergency approval. Okay? They have gotten emergency approval. Okay? So that people can, all over the world, can rely on it, that they are safe, they've been found to be safe, and they can give you some certain degree of protection. Maybe not 100%, as we are beginning to find out now.
Above 50.
Okay, but appreciable degree of protection can be gotten when you take the vaccine. Beyond that, if you take the vaccine and you probably end up with a breakthrough infection, which may not be likely, less than 1%, I said, you're not likely to have a severe disease. You're not likely to get hospitalized as a result of such an infection, and you're not likely to die from that infection. And all of this cannot be said for people who are unvaccinated. I have also had people coming to ask me, what do you have to say about this? What do you have to say about that? I encourage the person, please go and take the vaccines. They are very, very safe.
So, doctor, since today we are focusing more on vaccine. Now, at a year, speculations, say we are about to have a third vaccine. First off, we never even get the first one, right? And then you say, okay, if we get the second one, I think it's to also help boost our immune and all of that. So now, is there going to be a third dose or not just mere say? And really, waiting be the essence of we having a third dose of the vaccine?
Thank you very much. Thank you very much. Before I answer that question, I want to quickly read what I have here. Okay, here are 5 things you need to know about the Delta variant. Number 1, Delta variant is more contagious than the other variants, than the other strains. Unvaccinated people are at risk. Delta could lead to hyperlocal outbreaks, just like sporadic outbreaks. Okay, number 4, there is still more to learn about Delta. Number 5, vaccination is the best protection against Delta variant, not Delta states. Okay, so now, going back to your question.
Yes.
It's not a hearsay. It's we should trust science. What happened at the beginning was that the original variant that actually came from Wuhan, the vaccine was tailor-made, if I can use that word in quotes, for that original variant. And that was why the vaccine was so effective at the initial stage. But as viruses mutate, just like humans grow, they've thrown up another big challenge. Okay, so the world has changed. You can look at it that way. Okay, so now the scientific community are not resting on their oars. They are trying to rejig the vaccines that they have made to be able to capture these variants of concerns that are causing a lot of havoc in the world today. Okay, so that it has been muted. Or the US, just like among the 5 things I mentioned, we don't yet have the full information. We don't yet know it all with respect to Delta variant. Okay, so within the next few weeks to few months, we may see a situation where the government may approve of a 3rd booster dose for people who already have, for people who already have or have received the 1st and 2nd, there may be a need for booster dose. Maybe that will help to protect such individuals who may get so opportune to have them from picking up the infection in the first place. Okay, so that can happen as early as September.
As early as September. That's next month.
Yes, that's towards the end of September.
As a matter of fact, that's like next week.
So it's on that note that we'll be signing out on this week. We surely will continue from where we stopped. Next week.
We'll continue next week, all things.
So we'll see you next week.
Yes, thank you so much for joining us on the show. I love you guys.
Thank you very much. Stay protected. Use your face masks. Wash your hands. Avoid crowds as much as possible.
Go about with your sanitizer.